Good morning. Welcome to today's presentation, which is coming to you guys via Department of Health and the Adult Immunization Department. We have the program manager, who is Kimberly Coleman, on that will be one of the presenters, and the second one is Mary Erdin.
Erdoiza.
Doyce. I always mispronounce that, but we have Mary Doyce on the line as well that will be giving a presentation along with Kimberly to talk about the importance of adult immunization and what we need to focus on, especially for our seasoned seniors that are 50 plus. And I'm going to turn it over to them right now so they can get into the presentation. At the end, they'll do some the general Q&A that they have questions regarding and give us information on that. And I will post some of the materials that they have via email. So sit back and enjoy the presentation. Kimberly.
All right. Again, good morning, everyone. My name is Kim Coleman, and I am the Health Equity Program Manager in the Immunization Division, which is housed in the Healthcare Access Bureau of the Community Health Administration at DC Health. Joining me today, I have Mary Erdoiza, who is our program coordinator and is directly responsible for community engagement, and she will assist me a little bit when we get to the end related to the common questions that we have. So without any further ado, I am going to go ahead and launch my presentation. Talking today to you about adult immunizations. I do need to provide this slight health disclaimer. I want to make sure that everybody understands that this is for educational and informational purposes. This is not medical advice or a professional service. Please make sure that you're not using this for diagnosing or treating a health problem or disease. You should always seek personal medical advice in consulting with a licensed physician or a nurse practitioner or a pharmacist or any other licensed health professional regarding any kinds of medical conditions. So today we're going to go through a number of things. This is our agenda, and you can see that we're going to cover quite a bit of information, and then we'll get to some questions. But I definitely want to kind of give you a primer of where we're going today. So again, we're talking today about vaccinations, immunizations, and they are important at every age. We're very used to hearing about the importance of children getting their recommended vaccinations, but not so much about adults. And it is important to remember that they are important for everyone at every age. The CDC recommends that you stay up to date on all of your recommended vaccines. We're dealing with those of you who are a little bit more wise and mature, and so you've got quite a few of those precious moments in your history, but we also want to make sure that you have more precious moments in your future. So it is important for you to stay up to date. Before we go into the vaccines that you should be definitely focused on, I just want to give a brief overview of how vaccines work. A lot of times we get information or get questions about or complaints about, well, I got this vaccine, but I still got sick, and especially we hear it a lot with COVID. So I want to make sure that you understand how vaccines work. Vaccines work excuse me, by introducing a weakened or a dead form of an actual bacteria or virus. It's introduced into your body, and what it does is that it actually stimulates and sparks your immune system to respond and develop antibodies, and those antibodies are almost like a lock. And what happens then is that when that bacteria or virus is introduced into your body on other occasions or after the initial vaccination, your body, that bacteria or virus fits into that lock just like a key. And it's because that antibody is specifically attuned to that key that it's able to turn the lock, and the body is able to say, oh, I know what this is, so I'm going to fight this off. Now, it doesn't mean that it's necessarily always a cure. And so it's very important to remember that sometimes how the body fights it off may mean that you may actually get the illness, which is what we're seeing sometimes with these different variants when we talk about COVID. But because your body has some level of antibodies to earlier variants, it means that you may not get severely sick or end up in a hospital or end up unfortunately passing away. So that's one of the things that we see with some vaccines like COVID. But then you have other vaccines like the vaccine for polio, which we know has basically eradicated polio in the United States and around the world because of the strong immune response to that particular vaccine. Also, another question that we get deals with the fact that sometimes people have questions about what kinds of ingredients are in vaccines. And so I want to make sure that you understand that every vaccine ingredient serves a very distinct purpose. Excuse me for being tongue-tied today. It's one of three. Either it's there to provide immunity, it's there to keep the vaccine safe and long-lasting, or it's there to make the vaccine more effective. And so one of the things that I want you to understand is that these vaccines go through rigorous testing, lots and lots of testing to make sure that they are as safe as possible to the human population. And so we make sure through this testing process, because we want to make sure, or the government wants to make sure that people are going to be safe. If you know that you have certain sensitivities to certain types of substances, again, this is where you need to speak with your doctor first, or a medical professional, if you think that you may have some sort of reaction to an ingredient. And you can always ask the doctor what kinds of ingredients, and not just the doctor, but the health professional, what kind of ingredients are in vaccines or the vaccine that you will be taking. So let's talk about the adult vaccination schedule. This is the 2024 recommended immunizations for adults aged 19 years and older per the Centers for Disease Control and Prevention. One of the attachments that is going to be provided or sent out along with this presentation is the fuller version of this adult vaccination schedule. And I want you to pay attention, especially to, I'm going to use my little laser pointer here, to the vaccines that start and go from about 50 to 65 plus. Those are the ones that you really want to take a look at. And those are the ones that primarily I'm going to be focused on today. Take this laser pointer off. All right. So we're going to talk about COVID. We know that the fall is coming up. We've heard in the news that rates are increasing. Rates of sickness are increasing and spread. But there are several things that you can do right now to help protect yourself, as well as, or in addition to immunization. We're going to talk a little bit about the flu vaccine. Everybody usually knows about the flu vaccine. We're going to talk about RSV. which is a virus that has been around actually for quite a long time, but we're seeing more of an uptick and more noticeable spread of this virus in more recent years. And so the wonderful thing is that now we have a vaccine for older adults. We're going to talk a little bit about the Tdap or TD vaccine, the shingles vaccine, another very important one for older persons, and the pneumococcal vaccine. Pneumococcal disease covers a multitude of different illnesses, but we will go over those as well. So once again, based on recommendations by the Centers for Disease Control and Prevention, also called the CDC, we're going to go over COVID-19, flu, RSV, Tdap or TD, shingles, which sometimes is also called zoster, and pneumococcal disease. So let's start. COVID-19. We all know what COVID is. It's a respiratory virus that can feel a lot like the cold or flu, or in some cases, pneumonia. What makes COVID very specific and dangerous is that it doesn't just attack your lungs and your respiratory system. It can attack other parts or affect other parts of your body. Most people with COVID have mild symptoms, but some become severely ill. And especially we see this in older persons becoming or at risk for becoming severely ill. And that's because and I say we, I'm over 50, but that's because in some cases we have additional health concerns or health circumstances or situations that are going on that may actually increase our risk for severe disease. Complications, you can see what those complications are, which is why it is so important to make sure that you get vaccinated. The current recommendation by the CDC is that everyone who is 5 years and older should get 1 dose of an updated or the updated COVID-19 vaccine to protect against serious illness. And you have a link there where you can actually go and look more, get more information from the CDC on the COVID schedule. Now, one of the things that I want you to know right now is that we are health departments across the country and around the world are waiting for the 2024-2025 updated vaccine for COVID-19 to be released and arrive. Right now, there are very limited, and I want to stress this, there are limited resources of the 2023-2024 updated vaccine. And I hope that everyone on this or watching this presentation has actually already received that or received that last year. If you have not received it, I suggest that you contact your healthcare provider to get guidance on whether or not you should try to go ahead and get the 23-24 updated vaccine, if available, or if you should wait to get the 24-25 updated vaccine. But at any rate, I do want to make sure that I emphasize to everyone that really getting the COVID vaccine is something that is very good for you. As someone who is older, I have personally gotten every vaccine that I could. I got the 23-24 vaccine as soon as I was able. And as soon as the 24-25 vaccine becomes available, I will go and get that as well. Again, if you have questions, you should always go and speak to a medical professional. Moving on to influenza. We all know about the flu. We've heard about the flu for a long time. This obviously also is another respiratory illness that infects the nose, the throat, and sometimes the lungs. And people don't believe it sometimes, but people do still, even today, die from the flu. And so it is very important to make sure that you get your yearly flu vaccine. Complications from the flu can be minor, such as ear infections or sinus infections. But if you have other type of medical conditions like congestive heart failure, asthma, or diabetes, it can actually make those worse. And it's important to know that, again, like I said with COVID, if you have additional health issues, you are at a higher risk of developing complications if you do get sick with the flu. Sometimes we hear people say that the flu vaccine gave them the flu. Again, these vaccines don't actually give you the disease or give you the illness. What they do, however, is they do spark an immune response. And sometimes when our immune system gets working and is developing those antibodies or fighting that disease off, you may get a low-grade fever. You may get the sniffles or a cough. You may get a headache, but it's not giving you the actual illness. What it's doing is it's your immune system doing what it's supposed to do and fighting disease. For the influenza vaccine, you should get 1 dose every year. And I will say that a lot of times, a lot of medical professionals these days now with COVID and with flu will recommend that you get the 2 at the same time. And that's okay. That actually is safe to do. Moving on, we have RSV. Now, everybody's like, well, what does that really stand for? It stands for respiratory syncytial virus. So RSV is another common respiratory virus. You're seeing a pattern here. It infects the lungs, but also can infect the nose and the throat. We see RSV being spread more often during the fall and the winter months, again, just like flu and COVID. But it usually peaks by December or January. One of the wonderful things about RSV, and even if you think about flu and with COVID-19, we tend to call these our fall respiratory viruses or respiratory virus season. And so when you're thinking about going to the doctor and getting vaccinated, it really is important for you to talk with your medical professional about getting all 3 of these at once if you meet the age criteria. So CDC recommends RSV vaccines for all adults 75 years and older, and for adults who are 60 to 74 if you're at an increased risk of severe RSV. How do you know if you're at increased risk? Well, you're going to talk with your medical professional. That can be a doctor, a nurse practitioner, a pharmacist, physician's assistant, about what other types of health issues you have. CDC also recommends an RSV if your ages 60 and 74 and you have chronic heart or lung disease. You have something that has caused a weakened immune system. You have certain other medical conditions such as severe obesity and severe diabetes, or you live in a nursing home or other long-term care facility. Complications from RSV can be very serious. They can be pneumonia, can lead to pneumonia, inflammation of the small airways in the lung. We call those the alveoli. And it's especially dangerous for infants, young children, and for older adults, which is why you hear or will see a lot more material in the media, on the news, talking about making sure that you get your protection. The RSV vaccine for adults requires only 1 dose. And so once you've been vaccinated for that once, you don't need to get it ever again. Next, we're going to move on to the TD or Tdap vaccine. Now, we have these put together because this is actually the way that they are manufactured and produced. You have the TD, which usually stands for tetanus and diphtheria, or you have the Tdap, which stands for tetanus, diphtheria, and pertussis. Pertussis is the nice fancy medical word for whooping cough. So we know that the TD vaccine actually protects people against tetanus and diphtheria. The Tdap vaccine protects people against tetanus, diphtheria, and pertussis. Tetanus is a bacterial disease. It actually will affect your nerves and your muscles and actually cause you to stiffen, and very more commonly is known as lockjaw, can cause lockjaw. Diphtheria is a respiratory disease that's caused by a bacteria that can actually cause your breathing tube or your windpipe to become blocked. And then pertussis, or as I said before, whooping cough, is a cough illness that can last quite a long time if not treated. So some complications. Complications of tetanus, we already talked about stiffening of the muscles, but that can lead to not being able to open your mouth, having trouble with swallowing or breathing, and could be so severe that it could lead to death. Complications for diphtheria, again, that's something that causes blockage of your windpipe, can lead to difficulty breathing, which can also lead to heart failure, paralysis, or also death. And then pertussis can cause a very violent type of coughing that makes it very difficult to breathe, eat, or drink. And especially in adults, it can then lead to weight loss, loss of bladder control, passing out, and even rib fractures have been known to happen from severe coughing fits. The TD or Tdap booster is needed every 10 years. All right. And that's because over time with this particular vaccine, the immunity that is provided by the vaccine tends to weaken. And so that's why it has been deemed that you should get one at least every 10 years or after 5 years if you have a severe or dirty wound or burn. We used to have, I know, and it still is true today, say if you cut your foot on, like something like a rusty nail or, a piece of metal or something along those lines, and you have to go get, go to the doctor or go get stitches. One of the things that you always get asked routinely is, when was the last time you had a tetanus shot? Well, when they say tetanus, they're meaning the TD or the Tdap shot. And most of us don't remember. So very often they'll say, okay, well, we're going to give you one just as a booster. But it is important that you keep track of that and should ask your medical professional when you got your last shot so that you can keep a record of it and also know when it's time for you to get your booster. The next shot that we're going to talk about is one that has become, I think, more promoted and talked about, I would say probably over the past maybe 30 years, and that's the shingles vaccine. Shingles, or also called zoster or herpes zoster, causes a very painful rash, and it actually is caused by what we call the varicella zoster virus, which is actually the same virus that causes chickenpox. And what happens with shingles is that virus, after we've had chickenpox, and I've had chickenpox, and probably I would say a good number of people who are at least 50 or older at this point in time have had chickenpox. And that, after we got over chickenpox, that that virus stays in our body, but it's dormant and it doesn't do anything. However, what we've seen with shingles is that for some strange reason, and we really don't know, medical professionals don't know why this happens, the virus is reactivated even after we've already had chickenpox. And so it causes this painful rash. And so you have a higher risk of shingles as you get older. We don't really see or usually see shingles in persons under 50. However, it can happen, but you are at higher risk if you are older. And serious complications can arise if you have certain medical conditions that affect your immune system. So certain cancers like leukemia and lymphoma and HIV infection. You can also have serious complications or the risk of serious complications if you take drugs that keep your immune system from working properly. So if you're on steroids or if you're on organ transplant drugs that allow you to your body to not fight your transplanted organ, but because those drugs affect your immune system, they actually may put you at higher risk for developing shingles and developing serious complications. Complications, again, severe, and these are rashes that have blisters. Some people have long-term nerve pain. They can have hearing damage, extreme complications, blindness, and even death. So you get this vaccine, you have 2 doses. Now, it is recommended that persons age 50 or older are recommended to get their shingles vaccine. Those 2 doses are given a certain number of months apart, usually I believe 2 months apart at the minimum. And then you're finished. You don't need to get any more of that particular vaccine. But it is a vaccine that we do encourage older adults to get, and especially anyone who is 50 years or older. Pneumococcal disease. Pneumococcal disease is the name that we kind of, the catch-all for any infection that is caused by the pneumococcus bacteria. And so this bacteria can cause a lot of different types of infections. It can cause pneumonia, which, as you know, is an infection of the lungs. It can cause meningitis also, which is an infection of the lining of the brain and the spinal cord. It can cause bacteremia, which is a bloodstream infection. Otitis media, which is a middle ear infection. Usually we equate that with what little kids get, but actually also otitis media is something that that adults can get as well. And so this bacteria can cause that type of infection. And then sinusitis, which is a sinus infection. Oh, I see a typo there. I will make sure that that gets cleared up. But a sinus infection is something that also is caused by the pneumococcus bacteria. Complications really depend on the the part of the body that has been infected, but it can lead to blood poisoning, which can be very serious. We talked about the infection to the lining of the brain and the spinal cord. It can lead to death if it's actually not treated and allowed to get out of hand or out of control. So it is very important, especially for older persons, to get the pneumococcal disease vaccine. The number of vaccine doses that you get can be 1 or 2. It depends on the vaccine type. There are several vaccine types for pneumococcal disease, but as of June 27th of 2024, updates have been made to the CDC website. And so adults are being recommended to get the PCV21 vaccine, pneumococcal vaccine. And what the 21 refers to is the different types of strains of the bacteria. And so it's very important that when you go to your doctor, ask them and to make sure that you're getting the recommended PVC 21 vaccine for adults based on the CDC recommendation. There are some other vaccines that seniors may need, and you really should talk with your healthcare provider to see whether or not any of these vaccines you need, especially if you are 60 years of age or older. Some people may need the hepatitis A vaccine, and this is a contagious virus that attacks the liver, and it's usually spread by contaminated food or drinking behind contaminated food or drink or close contact with someone who has hepatitis A already. Then there is hepatitis B, which is another contagious virus that attacks the liver, and it's spread through contact with infected bodily fluids such as blood or semen. There is the meningococcal vaccine. This is a bacterial infection. And this is a very specific vaccine that is developed specifically for meningitis. And so it is important for some people, again, talking with your healthcare provider, to see whether or not you need to get this vaccine. There is the Hib vaccine, which is a bacteria, which which helps provide protection against a bacterial infection that can attack the lungs, the brain, spinal cord, or bloodstream. And then some of you may have heard in the news about Mpox. This is a contagious viral infection that is often spread by sexual contact or close skin-to-skin contact. It can cause a painful rash, fever, headache, tiredness, cough, runny nose, sore throat, and swollen lymph nodes. If you talk with your healthcare provider and you find that you are in a risk, a population that is of higher risk for contracting Mpox, it is important that you talk with that health professional about you getting the Mpox vaccine as well. So where can you go to get your immunizations? Well, the first and foremost place is always to look to your primary care provider if you have one. Your physician, your nurse practitioner, your physician's assistant at your doctor's office. So that's the first place that you should look to because they usually have those in stock and they're very familiar with your health history. You can also go to most area pharmacies, not only your commercial pharmacies, but also take a look at your community or smaller community pharmacies. One that comes to mind, and I'm not promoting any one over the other, but one that comes to mind is Grubbs. And there are several other smaller community pharmacies. Your pharmacists are trained and able to provide vaccines, adult vaccines, if they have them in stock. And so you can definitely reach out to those. You can go to any DC federally qualified health center or FQHCs. An example of some of the FQHCs in this area are Mary Center, Unity, let's see, what's another one? Family Medical and Health Services. Go ahead, Mary.
Community of Hope.
Community of Hope, yes. So, and if you need information to help find those DC federally qualified health centers, you can by all means call DC Health, or you can actually look online, or you can email. Well, I have an email list at the end of this, and I'll let you know who you can email to get information about that. You should also look to the DC villages. They're going to be having clinic events as we're coming into this fall respiratory season. And so you should see village directors and or look out for flyers for more information. They will be having some of those at some of your DC villages locations. And then if you need additional information, another document that's going to be provided along with this is a 2024 district adult vaccination locations document that has been developed. If you have access to being online, you can definitely click or go to DC Health and click on immunizations, and we have that document ready, and it's broken down actually by ward and includes area pharmacies, federally qualified health centers, as well as some limited primary care providers who have listed with us. All right, so we've covered a lot of information, and I know that people still have questions. And so I'm going to, because Mary is the person who usually is directly out and about and talking with the public at our events, I'm going to ask her to cover some questions that she normally gets at this time.
Okay, thank you, Kim. So the first question would be, why do some vaccines require boosters?
Okay, why do some vaccines require boosters? All right, some vaccines require boosters simply because the way that they have been developed and the way the body utilizes them, the antibodies actually decrease over time, and so our immunity decreases, and so we require a booster, if you will, to kind of trick our, I don't want to say trick, but to have our bodies develop antibodies, enough antibodies to that particular bacteria or virus, so that we can make sure that we stay as protected as possible. Again, you see that a lot. Again, we talked about the Tdap or the TD, and that's especially because of tetanus. And so you do need to make sure that you get that booster every 10 years or every 5 years if you've had some sort of nasty burn or cut. And I actually see some questions in the chat, Mary. So there's a question that says, if you have recently had a COVID infection, how long should you wait before getting a booster or new vaccine? So the first thing I'm going to do is say, if you have recently had a COVID infection, I'm sorry. But I am going to say also the good thing is that you actually got over that. And so the question said had. So that's a very good thing. How long should you wait before getting a booster or new vaccine? So if it is recommended by the CDC, then what we were seeing more recently with the 23-24 updated vaccine, and we actually don't call them boosters anymore. We call them updated vaccines because very much with COVID, COVID vaccines are very much like flu vaccines in that when we are looking at a new or an updated version, it's not the same type of the exact same type of vaccine formula. Usually, it usually is the updated version. We do know that so going back to what I was saying, for the 23-24 updated vaccine, earlier this year, there was a suggestion by the FDA and CDC that persons who were over 65 and had I believe it was, and I'll go back and check, but I believe it was had received the 2023-24 updated vaccine. I think it was 3 months, but I'll go back and check. Could go and speak with their healthcare professional about getting a second dose of that 23-24 updated vaccine if they were at increased risk or met certain criteria for being at increased risk. But again, that was something that the CDC and FDA recommended following talking with a healthcare professional. After you immediately get a vaccine, do you need to, if you get infected, do you need to go get another shot? No, you don't need to automatically get another shot. And again, like I said, that second dose of the 23-24 updated vaccine was recommended for persons who were either 65 or at increased or higher risk after speaking with their medical professional. Now, as far as the new vaccine, well, we are eagerly awaiting the arrival of the 24-25 vaccine. And if you have had had an infection recently, when that shot comes out, guidelines for how long you should wait between an infection and getting that new 24-25 updated vaccine will be released at that time. Okay.
So for another question, are vaccines linked to health problems like autism, asthma, or diabetes?
Really good question. So, as I said before, the science behind the development and the rigorous FDA process for approval for vaccines is something that is not taken lightly. And there have been and continues to be studied even after it has been approved for widespread use and deemed to be safe. There have been no credible scientific medical research data that has linked vaccines to autism, to diabetes, and what was the other one?
Asthma.
To asthma. All right. What I will say as far as especially that piece about asthma, and that's why I kind of blanked for a minute. Sometimes people do have reactions, adverse reactions to vaccines. It does not happen that often, but when it does happen, there is a recording system that requires medical professionals to report directly to the federal government and take into account that following getting this vaccine, a person had these types of adverse events or had these kinds of serious events that happen. In some cases, that might be, shortness of breath. It might be a person may have broken out in a rash, had a headache, had a severe headache. Things like that have to be recorded and reported to the federal government. Now, does it mean that, and that's why I talked about the ingredients, does it mean that certain ingredients may cause some sort of reaction that is not normal? Okay, again, an adverse reaction that is not normal. It may, which is why you should definitely talk with a medical professional about vaccines and what's in vaccines if you have a concern, if you have severe allergies. I have a relative who can't take certain vaccines because the vaccines have may have certain types of products that are related to eggs. Well, she's allergic to eggs, so she can't take that particular or those particular vaccines. So it's important to speak with your medical professional if you have questions. But to answer that specific question, no, there is no research, no credible, let me change that. There is no credible research, meaning that it has adhered to scientific research policies and protocols that has shown that there is any connection between vaccines and asthma, diabetes, and autism. I see another question here. Can you explain the immune response related to vaccinations? Many people believe they are infected with a low grade of flu or COVID after receiving the vaccine. Wonderful question. So what happens, and I'm gonna actually, in answering that, I'm going to go back up a little bit. Let's see, is this gonna let me go up? Yeah, I'm gonna go back up. Oh, wrong one. Come on. I'm gonna go back to talk a little bit again about how vaccines work here. So again, what happens here when you talk about a vaccine introduces a weakened or a dead form of the virus or the bacteria. Usually it tends to be some protein that has been pulled out in a scientific manner. And that vaccine then causes your immune system to respond, which is exactly what your immune system is supposed to do. Your immune system is supposed to, when something foreign gets in there, it goes to work, all right, in a normal, healthy person. And so what the vaccines do is, as I say here, they work by imitating an infection so that the body's natural defenses, such as, or in other words, the immune system, actually learns how to fight, okay, the disease without getting a full-blown infection. Now, what happens and why some people tend to say, oh, it gave me COVID. I got the COVID vaccine and it gave me COVID. Folks, I don't even know how to say this more plainly. It did not give you COVID. It didn't give you the flu. All right. What it did do was that it stimulated your immune system. And when your immune system fights any kind of disease or any kind of foreign subject, it can cause an immune response. All right. When those white blood cells are fighting that germ off, if you will, it can cause things like a low-grade fever. Okay. Fever is actually not a bad thing. A low-grade fever is not a bad thing. That's letting you know that your immune system is working. Okay. If it gives you a high-grade fever, that's more of an adverse reaction. And again, you need to let somebody know, your medical professional know, hey, I got this vaccine and I went home and, I started, I had a fever. The fever was, like over 100. And, is this normal? Talk to your professional. Engage with them if you think that something is severe. Might it give you a headache? Yes. Might it give you the sniffles? Might it make you feel a little bit run down for a day or two after? Yes. But that's because your immune system is actually working and developing antibodies so that the next time you are your body is introduced with that full-blown COVID virus or that full-blown pneumococcal bacteria, it goes, hey, I know what this is. Boom, I'm going to fight it. I got what I need to fight it. So that's what is taking place. And some people, when they get vaccines, sometimes some people, they feel kind of crummy for a day or two. But it's not giving you the flu again, or it's not giving you that particular illness. Again, if you are having severe types of reactions, what you need to do is call and speak with your medical professional, okay? Or the person, call and speak to you can call and speak to the pharmacist, but especially a medical professional who can help you understand whether or not you're having a severe adverse reaction to a vaccine, or if it's just the normal immune response doing what it's supposed to do? Great question. I see another question, Mary. So,
Yes, the question is, what do you think about getting the flu, COVID, and RSV vaccines at the same time?
wonderful question. Again, so this goes to something that I had said before. We are now about to enter respiratory virus season. And so very often, once these vaccines become available, the medical professional that you're with may ask you, okay, well, you're at risk for flu, for COVID, for RSV. Do you want all three? Like I have them today. Do you want all three together? You can, and the CDC has said and FDA has said that it is safe to get all three at the same time. Okay. But again, you want to speak with the medical professional, and they may advise you to get two and come back for one of the other ones or something along those lines. It just depends really on your medical health history and what your medical provider says. But what I will say is that, if the medical professional says it's safe to get all three for you, and they have all three, yes, according to CDC and FDA guidelines, you can get all three at the same time, knock them out, and be finished with everything you need to be adequately protected for the fall respiratory virus season. Great question. Thanks. Next question.
Here's another one. In the future, will the RSV require a booster?
Will the RSV vaccine require a booster? So, as I said before, even though I have a doctorate, I'm not that kind of a doctor. I'm not a medical doctor. I'm just a really well-trained health educator. What I can tell you is what I have read, and what I have read right now, based on FDA and CDC guidelines, is that RSV does not currently require a booster. There don't seem to be any plans to require a booster for RSV. And so based on the guidelines that CDC has, you get one vaccine for RSV and you're done. So one and you are done. Great question. Any other questions, Mary?
I think we have time for one last one. And,
okay.
Do older adults have the same level of natural immunity as younger people?
Do older adults have the same, give me that question one more time.
Do older adults have the same level of natural immunity than younger people?
The best way of answering that question is overall, yes, but as older people develop other health concerns. So, as we get older, we tend to get other types of illnesses. So if you're older and you have hypertension or high blood pressure, okay, that then is one type of additional health concern that may have an impact on your immunity. If you have heart disease, other forms of heart disease, that may actually impact your immunity and your ability to fight off certain diseases. If you have diabetes, okay, so if you start to see a pattern here, if you start to have some sort of, if you have respiratory illnesses, other respiratory illnesses, I will say if you are a smoker, okay, because it's not just illnesses, but it's also behaviors. If you are a smoker, that can actually, it does impact your immune system and other bodily functions. If you are obese, all right, that has an impact on the way that your body and your immune system can function. So as you get older, it's not so much that do you have a different type of immunity than a younger person. It's how healthy are you as you're getting older? And so a lot of times, because we do have as we get older, we have other types of health issues. In some cases, we are placed on medications that may impact our immune system, that we don't have the same level of a robust immune response as some of our younger counterparts. And so that's a wonderful question. But ultimately, so the goal then is, if you want to keep your immune system as strong as possible, it means that you manage your weight. It means that you cut down on salt and fat in your diet. It means that some other protective things you can do. You exercise or engage in regular physical activity. That can be walking, that can be lifting weights. And lifting weights doesn't have to mean that you go out and you buy barbells or have to go to the gym. You can actually lift some cans.
Mm-hmm.
You can lift canned food. Do bicep curls and lift them and push them over your head. You can sit in your chair and do leg lifts. Okay, there are a lot of things that you can do as you get older to continue to strengthen and keep yourself healthy and to booster that immune system. Also, eating, I said eating healthily, but yeah, eating more fruits and vegetables, lean meats, drinking plenty of water. You'd be very surprised, but drinking water really is important, especially as you get older. So there are a lot of health behaviors that you can engage in, even if you have some other health disorders that you may not be able to correct with healthy behaviors, things like type 2 or type 1 diabetes. Sometimes, you have those. And even though you're managing them well with your medications and with diet and exercise, you may still be on certain medications. You may still have those diseases, but it doesn't mean that you give up on doing the most that you can to keep your body as healthy as possible. And so you do those things, and then you also get your recommended vaccines on schedule when they are available. So I'm going to skip down to my last slide, and then I'm going to turn things over. I want to give a special thank you. Shout out to the immunization team members who work most closely with me on this project, to our immunization division chief, Mrs. Heather Burris, to definitely Miss Mary Erdoiza, who again is our program coordinator, to Jacob Mafor, who is our adult vaccine coordinator, and to Juliet Brown, a nurse specialist who assisted me with the development of this presentation. If you have any questions, by all means, please feel free to email myself or Mary. If it's a more clinical question, you can reach out to Miss Brown, or you can contact myself or Mary, and we will make sure that we get it to Miss Brown. That being said, I thank you on behalf of DC Health. Our Director of Health is Dr. Ayanna Bennett, and the Senior Deputy Director for the Community Health Administration is Mrs. Robin Diggs Purdue. And to that, I will stop my share and turn things back over to Katrina.
Thank you so much, Kimberly, for this invaluable information. This session was wonderful. I took copious notes so I can educate people along the way, and I learned some information from me as well, because I too am over 50. One of the key pieces is that you mentioned in terms of respiratory virus season, right? I said that correctly?
Yes.
Because I want to be able to tell people that's what we're entering now in terms of the fall.
Yes.
And that makes us a little bit more vulnerable to some of these particular pieces that you mentioned. But I wanted to thank you and Mary for providing this presentation. And I think that, I know we will replay it and post it on our YouTube channel. And we actually, any materials, like I mentioned earlier, that you want us to share, we will do that via email. And I want folks to remember that this is a presentation is brought to you by DCVC, DC Villages, in an effort to offer citywide programming virtually and in person. So look forward to your next presentation, which is on September 17th at 11 o'clock. Am I correct?
Yes.
Yep.
Okay. Same link. It's the same link. And I hope to see everybody again at that time. And once again, Kim, thank you so much.
You're very welcome. And thank you to the DC Villages for everything that you are doing to get the word out. We do appreciate it.